Good morning, hair scrippers. How are you ladies doing today? This is Beverly Hines, the founder of Hair Scripts, the platform connecting Black and brown women experiencing hair loss to hair restoration specialists like Dr. Yolanda Lenzy, who we have the pleasure of speaking with today for treatment options. Dr. Yolanda Lenzy, can you please introduce yourself to the hair scrippers that we have in our community today?
Sure. Hello, everybody. My name is Dr. Yolanda Lenzy. I'm a board-certified dermatologist. Uniquely, I'm also a licensed cosmetologist for over 25 years, and I integrate my background in cosmetology with my practice of dermatology. And I'm the owner of Lenzy Dermatology and Hair Loss Center located in Massachusetts. And I just like to help women and men and children who are experiencing hair challenges to get restoration and when possible and get their conditions under control. So I'm happy to be here.
Thank you so much. So I'd like to ask everyone before we go into what the topic is today, what's your hair story? Not only what's your personal hair story, but what kind of led you into this line of work?
Sure. My background in high school, I was really interested in the cosmetology. I used to do my mom and my sister's hair, and my high school actually offered cosmetology training there. So I had a petition because I was in the college track that I also wanted to do the vocational education track. So I was the first student to do both. And in that training, I really learned the science of um, cosmetology, beauty, hair cutting, hair color. And I always had in the back of my mind around that time that I wanted to go into medicine from my experience with my dermatologist. So I thought that this would be a great way to integrate my two loves of science and beauty.
That's awesome. You know, first of all, I had no idea just from looking at you. By the way, guys, if you haven't followed her on Instagram, Dr. Yolanda Lenzy, what's your Instagram handle?
It's my name at Dr. Yolanda Lenzy with DrYolandaleNzy.
If you guys don't follow her yet, please go ahead and follow her. Her page is very personable. Although she is a medical doctor, she is a dermatologist, she does mix in a lot of beauty with a lot of medicine. So she makes it so relatable. But just to hear that you started off in cosmetology is key to me. I had no idea that you have a background in actually doing hair. Are you still practicing cosmetology now?
I know. I do my own hair, but to get it done during the pandemic, I was forced to pull out my old.
Right.
So
Okay. As long as
it's
you
always,
still got it in you for you, that's it.
it's always good to have a skill, right? Because you never know when a global pandemic
Right.
happens, shutting everything down. So yeah, but I did hair in college and medical school actually, and that's how I made extra money. And so it's just been a great skill to have. And it's really helped me in my practice of dermatology because a lot of my patients, not only are they looking for medical treatment, they want recommendations of products and what shampoos should I use, what conditioners, what this, that, and the third. So it's really helpful to have that background.
Right. Well, that's a good transition. So let's start talking about medical treatments for women experiencing hair loss. But I want to take this step by step because I think the huge misconception about what hair loss is. A lot of women who are hearing this will say, well, I'm not experiencing hair loss, so this isn't relevant to me. Can you make this relevant to the everyday woman?
Sure. So even if someone is not experiencing hair loss per se, everyone has to care for their hair. So the first conversation that we have in discussing hair loss is just scalp care, general scalp cleanliness, scalp care, health, all of that is relevant to all of us because we all have to cleanse our scalps, cleanse our hair. And so hopefully we share some tips today that people can find useful.
Right, and we can jump right in. So what's one good tip for someone who has never really cared for their scalp before for them to start the process of maintaining a healthy scalp?
Sure. I think this kind of goes without saying, but I think in today's climate, we need to say it's important to wash your hair, to wash
That's
your scalp,
huge.
not
Yes.
cold, not conditioner. I'm talking about a good shampoo. Is really important because just the way we cleanse our skin, our face, our bodies, we have to cleanse the scalp because the scalp is skin. And so
Right.
sometimes in the natural hair industry over the past few years, people have abandoned shampooing. And that is not something as a board certified dermatologist that I recommend at all. I recommend
Okay.
cleansing the scalp the same way we cleanse the rest of our bodies, not with lotions, not with conditioners, but with a cleanser, a shampoo. So yeah, so very, very, very important. Definitely the type of shampoos you use is important. So I think we kind of threw the baby out with the bath water, if you will. And
Right.
there are some shampoos that probably not the best for afro textured hair, coily, kinky hair. You're probably going to want to look for more moisturizing shampoos and conditioners, maybe sulfate free at times. Sometimes you may need to use a sulfate to really get a full cleanse. So it's just really important to think about who we're listening to and if there's any science behind the things that people are recommending to us.
So, two questions that I have, follow-up questions. The first question is, how often should we wash our scalp or hair?
Sure. And I get asked that question often by my patients. And I really say it depends on you, your lifestyle. Are you exercising? How active are you? How sedentary are you? And so that's really going to determine how frequently, like I just bought a Peloton bike 6 months ago. So I'm getting it in. I'm sweating a lot more than I used
Right.
to. So with sweat, there's a lot of salt and things and mineral buildup that needs to be cleansed more often than if you're not sweating as much. But in general, for most people, I like once a week, especially if you're putting things on your scalp and hair. That can lead to a lot of buildup that you're going to want to cleanse off. Sometimes I say you can go 2 weeks, but I'm not a fan of 3, 4, 5, 6, 7 weeks that some people do. Um, just
Right.
from a just from a hygiene perspective, I think it's very important to because we our hair can't optimally grow if our scalps are just covered, filled with bacteria and yeast and all kinds of things that
Right.
get on our scalp. We need a healthy environment for growth.
Right. Thank you about that. So, you listening, ladies, listen to your hair and your scalp. Everyone's lifestyle is different, but when you
Mhm.
start to feel like it's getting funky, just like you know it's time to wash up down there or anywhere else on your body, listen to your scalp. It will tell you it's time to be clean. And my second question, to basically to your tip is there any safe, you want to say, and then we can define safe by like clean or non-toxic shampoos that you recommend that's over the counter that we can pick up?
Sure. I mean, there's a lot of great products, on the market, and I definitely recommend that people do trial and error. I mean, in general, like I recommend a lot of sulfate-free products. In terms of you wanted brand recommendations, or what were you looking for in particular?
Well, you know what? We're not you're not sponsored, so I mean, it's up to you if you want to give a brand recommendation, but if not, what should we look for, let's say, in the label?
Sure. So a lot of work has been done over the past few years around something called endocrine disruption. I'm not sure if you all have heard of that term before, so I'll kind of break it down for you. So one of the things that we've noticed
Right.
of late
Yes,
is that
please.
yeah, African American women in particular are suffering with certain conditions more than our white counterparts. And some of these products
Mhm.
that we use have been linked to chemicals that alter our endocrine or reproductive systems. Okay. So things like parabens, things like phthalates, things like ethanolamines, long names. I mean, if you Google endocrine disrupting chemicals, you'll find many lists out there. And so, you'll be surprised. And I don't
Right.
want to say anything under the bus right now, but you can go do the research yourself. You'll be surprised that there are many products that many of us use as children that are on the list containing high amounts of these chemicals. And so you may say, why is this important, Dr. Lenzy? It's important because these chemicals have been linked to increased risk of breast cancer, increased risk of infertility, increased risk of possibly uterine fibroids, which Black women suffer from in much higher numbers than our white counterparts. So it's very, very important to do this research, and more research definitely needs to be done. But my mantra is with regards to chemicals and products is when in doubt, leave it out. And you may hear me say that for other things we may talk about. When in doubt, leave it out. With regards to certain hair care practices, if you're dealing with hair loss that possibly could be linked to worsening the hair loss, when in doubt, leave it out, because there are other alternatives. So I want us to kind of become more educated. And this is kind of newer information. There was a study that came out in December that was done by the National Institutes of Health called the Sister Study. And you may have seen this. It hit the headlines. Basically, individuals who use certain chemicals in hair dye and also relaxers, and some of the relaxers contain some of these endocrine disrupting chemicals, they had higher risk of breast cancer. So this is like new information that hasn't been talked about in years. People really need to do a lot of reading and a lot of research to really educate ourselves regarding these particular things that could be putting us at not just risk for our hair challenges, but internal body concerns like breast cancer, fibroids, things like that.
Right. This is mind blowing for me specifically, because we know about some, we used to call it creamy crack as far as the perms and how it affected our actual physical hair, but not even how it affects our overall health. Sometimes we just think, oh, it burnt my hair, my edges, but we didn't think about how it's actually affecting, how it can contribute, God forbid, towards, breast cancer and other things like that. So there's a lot of us starting to become DIYers because we're so afraid of over-the-counter products and what may or may not be in it. Some of us don't know all the endocrine disruptors. Did I say it correctly, Dr. Lenzy?
You said it right.
Some of us may not. Right. Okay. Some of us may not know all of them. So, is there like a particular product that we can use or a go-to kind of natural or natural ingredient, whole food that we can use to cleanse our scalp?
I think it's very difficult to create a shampoo from nothing. And so you really want to look for labels that says that it does not have these things that I mentioned, like parabens, which are preservatives that are in a lot of products. So it's really hard to find something that's paraben free, phthalate free, which is PHTHALATE. So it's spelled a little bit different. Maybe
it's
you could
different than how.
Yeah. And so maybe in the notes we could put a list of some of these chemicals because they're difficult to spell. But it's just to tell people that we really need to do research, because a lot of this information is not just put out there, and a lot of people are creating product lines themselves. And so you just really need to have science to drive this, to be driven by science versus just what's popular on YouTube or other places, but actually looking at safety.
Right. So that's what I'm going to do, ladies. I'm going to link a lot of the ingredients or these chemicals down below, especially if you're on YouTube, so you can see it in the description box. Endocrine, right? Am I saying it correctly?
Endocrine, yeah.
Okay, great. So the next thing I want to go into is exactly what is hair loss and because just a quick background on me, I've always had a head full of long, thick hair, kind of midway down my back. Sometimes it's gotten, closest to my lower back. And I didn't notice my hair loss until 2018 when there was a whole lot of shedding during my wash days, which led me to going to a dermatologist who then diagnosed me with female pattern hair loss. nothing really looked that different. It just seemed like I was shedding, and I just thought maybe, I'm putting on the wrong, products. I don't know if you guys are aware that there was there's been this issue with Diva Curl recently where a lot of women are saying that Diva Curl was responsible for a lot of their hair loss. And so sometimes I just thought, oh, maybe it's the products that I'm wearing, or maybe it's something I ate. So what should we for? How do we know that we're actually experiencing hair loss? And I was, at the time I was maybe 32, 30. I was pretty young, so I didn't think that that was anything I would have to deal with. And I never really did a lot of, heavy styles or wear of extensions. So I didn't think that I would be affected by this. And my mother has a head full of hair, and so did her mother and my grandmother. So how did that happen to me?
Sure. So the type of hair loss that you describe, female pattern thinning, is also called androgenetic alopecia. So in most people, there is a family history. However, I always explain to my patients that sometimes we don't read the textbook, and so I have many patients who are the only ones in their family with female pattern thinning. And so this is a form of hair loss, which is actually the number one form of hair loss in women. And what happens is the hair follicles themselves become smaller. So they go from the normal size to a smaller size. And this process is called miniaturization. So this
Mm,
miniaturization happens, and those hair follicles are still there. They're just tiny. So those tiny follicles put out thinner hairs than the normal hair. So this is why women classically see they can see through their scalp in the crown versus the rest of their hair, because these are the follicles that undergo that miniaturization. And so, for many people, it's not anything you
right.
did wrong. It's not caused by any hair care practices or not shampooing or anything like that. This is a condition that can just happen. Like I said, most times it is
Wow.
genetic, but many times some people can just develop it. But the great news about female pattern thinning is there are great treatments. I always explain to patients is if there was one or two forms of hair loss that you could choose to get, not that anyone of us would choose to get it, but this is the type to choose to get because there are great treatments out here. Some of the
Oh
forms
my
of hair
God.
Some of the forms of hair loss, in contrast,
Thank
don't
God.
have great treatments. Yeah, so the scarring alopecias, for example, don't have a lot of great treatments or as good treatments as female pattern thinning. So it's important for our audience to
So
realize that
what is
there are.
scarring alopecia for those who don't know?
Sure. So I'll break it down. Hair loss is broken down into two major categories. There's non-scarring hair loss, and then there's scarring hair loss. So non-scarring hair loss, which is what female pattern thinning falls under. In this form of hair loss, the stem cells at the bottom of the hair follicle, they're still healthy. They're still able to generate new hairs. In contrast, in scarring alopecia, the stem cells are damaged by inflammation, and that leads to permanent destruction and scar tissue formation. And then within each of those two big categories, there's like 6 or 7 in each category. So, female pattern thinning is non-scarring. That's the reason why I can grow back so well with treatment. Alopecia areata, another form of non-scarring hair loss. Um, Telogen effluvium, which is excessive shedding. That's another form of non-scarring hair loss. Scarring hair loss, on the other hand, the most common form in African American women is the condition called CCCA, three C's and an A. And that stands for central because it happens in the
Okay.
crown. The second C is centrifugal, which means that it expands outward. The third C is just a Latin word for scarring, which is cicatricial, long word. And then A is just alopecia. So we just call it CCCA for short. And I'm going to go over all of these forms of hair loss in my book, which is called Getting to the
Okay.
Root. You can link that in the notes. But I have a chapter on each of the forms of hair loss.
Absolutely.
Yeah. So that's how we break it down. So that's why it's important to see a board certified dermatologist that specializes in hair loss, because the first step is to get a proper diagnosis. So for you, if you didn't go to a dermatologist, you might not know if you had uh, female pattern thinning versus if you had alopecia areata. And the treatments are different. That's the reason why getting an accurate diagnosis is the most important step, because if you have the incorrect diagnosis, you're going to be using the wrong treatments for the type of hair loss that you have. And so that's why this is very, very, very important to see someone who's an expert, because you deserve it. You don't want to waste time. You don't want to waste money.
Right.
Hair follicles, because remember, in the scarring forms of hair loss, it's permanent. So we need to get a diagnosis ASAP before you permanently lose follicles. So very, very important.
So I have a few follow-up questions, because I think that now we've actually touched on the meat and potatoes of this conversation, and this is what's so pivotal and so important that I don't want anyone to miss. Number one is there are so many forms of hair loss, so many types, and they present in so many ways that there's no way, as not to say a regular person, right? But if I'm not medically certified, if I'm not licensed, if I'm not trained to know what this is, I don't even think that in 2-3 calls you can explain or teach me how to identify those types of hair loss.
Mm-hmm.
So it's very important, like you said, and just kind of piggyback off of what you said, for us to get treatment, early treatment, before it's too late. Do not try to self-diagnose. Do not go to Dr. Google, WebMD, and these days, don't go to YouTube and Instagram, because you're going to end up losing your hair permanently if you don't see a professional immediately. So my question is, I'm not trained to know what type of hair loss, and I don't want to know at this point, because there's so many, and I'm one of those neurotic people that will go crazy trying to figure it out. But what can I look for? What early signs should I look for to say to myself, okay, it's time to get an appointment with a dermatologist to get this treated?
Sure, that's a great question. So things that you can look for. One, you need to look. You need to look at our scalp. If you're not doing your hair yourself, have your stylist to go through your scalp, let you know if there are any areas where the density is not like the rest. So if you have a head full of hair and you have a section where it's broken off and the hair is very short, that's not normal, right? Because general breakage happens all over the hair.
Right.
So if you have an isolated patch that is shorter than the rest, also is experiencing symptoms of like itching, tenderness, pain, that's not normal. And that should be evaluated. So, one, you want to look for if there's an area that looks different from the rest. Two, you want to look for, is there an area where there are a lot of symptoms? Three, you want to look for, are there any scaling, flaking, a lot of buildup on your scalp? That could be a sign of certain forms of hair loss as well. And then you also want to look at how much you are shedding. So I want everyone to know it is normal to shed hair every day. So we normally lose about 1 to 200 strands per day. So I have a lot of people who come in with a bag of hair and they say, this is the hair that I've lost over the past month. So it's no way of me to know if that's too much or not. But we do a little test in the office to see if the amount you're losing is more than this 1 to 200 strands per day, because there is a normal range and then there's an increase of that. So you want to look to see, am I shedding more than I used to shed? And so I don't like people to get neurotic about counting the hairs. Just look at, is this more than it used to be? That's a good rule of thumb. Even with the skin, since I am a dermatologist, I'll give a plug around looking at our skin. So if you have a mole that used to be brown and now it's black and white and red and it has multiple colors in it, That's a change, and that should be evaluated. Same thing with our scalps. If you used to lose this small amount of hair, now you got a big ball of hair over the same period of time. That's something to have evaluated. So these are things that we can do at home, but it really comes down to being more aware, looking, taking the time to,
Right.
look at things ourselves. And if you're not doing your own hair, seeing a stylist who is educated, because not all stylists have the same background. This is why I'm passionate about educating stylists so that they can, because many times I say they're the front line. For people who don't do their own hair, they have no clue what's going on back here. But the stylist is looking through the whole scalp as
Right.
they're detangling, as they are twisting, as they are, setting, if they're doing a flexi rod set, whatever the style is, the stylist must be trained, because in cosmetic
Right.
school, we don't learn the things that we need to know to really be able to identify hair loss. So that's where continuing education comes in for stylists. As dermatologists, we always do continuing education. So all of us need to always be continually educating ourselves, whatever field we're in. So these are important things that people can look out for.
Right. There is so much to unpack. One of the things I think of, well, a comment I want, a little quick story, and then I want to go into early signs again. I didn't even know that I was supposed to see a dermatologist, and I think that that's one of the biggest problems is most women do not even have the awareness that a dermatologist can treat hair conditions, unhealthy hair, or hair loss, for the lack of a better term. But for me, it was an accident in a sense, right? But it was a divine accident because I just happened to go to a dermatologist all the time for my skin. I was dealing with acne around this same time, and my dermatologist been treating me over the months about skin, and she was noticing that my hair was just getting thinner and thinner and thinner. So she recommended taking a look, like, hey, can I take a look? I know you're here for your acne, but let me look at your hair. And
Mm,
and so I never, thought to ask her to even look at my hair because
right.
she's a dermatologist. All she does is skin, no? At least that's what I thought. And I figured if you do go to a dermatologist for hair loss, is at the point where your scalp is on fire and there's no return. And I guess maybe I don't know. Like that's how we think. But I
Mhm.
want to talk to the person who is neurotic like me, and you might notice some shedding that's a lot more excessive than the norm, and you're going to schedule that appointment right away to come see you. While I don't think you mind, I think, because one of the things that a lot of us women, especially African American women, talk about all the time is our edges. When we notice our edges leaving, should we run to a dermatologist? Should we schedule an appointment when we notice that our edges are either, I don't know, how do you say, receding or falling out? Or what's the actual term for edges, by the way?
Yeah, we call them thinning edges. Thinning edges. There's thinning crowns. You can use any of those terms. But yeah, definitely. I think that that should be your first stop. I think many times what I'm seeing on social media is
Mm,
people are asking for recommendations of over-the-counter oils and potions and lotions that they can use when they notice thinning edges. And the thing about this condition called traction alopecia is it's very much treatable if you catch it early. If you stop whatever it is that's causing it, which is typically history of certain hairstyles like braids, weaves, locks that are very heavy and tight, and ponytails over time. If you stop these things while those stem cells, remember we talked about the stem cells earlier, while the stem cells are still healthy, we can regrow that hair.
right.
The problem is many of us continue these
Mm,
styles for years, months, and years and decades, and those stem cells can become scarred, just like the scarring alopecias. So traction alopecia is the one form of unique hair loss that is both non-scarring initially, and then it can become scarring. The rest of them are what they are. They're either non-scarring,
wow.
scarring. Traction alopecia is actually both initially non-scarring, so very treatable, but later can become scarring. So this is the reason why you want to present to a dermatologist, and preferably one who specializes in hair loss. Because guys, I'm not going to lie to you and say that all dermatologists are great with treating hair loss, because they're not. And so I've had many patients who come to me because they went to a dermatologist who was not as familiar with hair, and specifically ethnic hair, and they were given things that weren't effective. And so this is why I'm an educator, not only to the
Right.
public, but I also do a lot of education of dermatologists. I do a lot of speaking at our dermatology conventions around ethnic hair, hair loss, and what to do. So it's my goal to kind of hit it at each level, for your layperson, for your stylist, for your dermatologist. I'm trying to educate everyone so that we can avoid some of these things that we're seeing so often, which is people not being treated for years and years. And then they come to someone like me, and we have limited options. So my goal in doing interviews
Right.
like this and doing whatever I do is to let someone hear this that is early on in the stages and say, hey, oh, there is help. Let me go get this evaluated. And even if you are late in the game, it's been going on for a long time, there's still help for you. Not saying that we can rejuvenate all of your hairs, because a lot of those follicles are probably scarred, but we can stop the progression so that you can
Right.
keep what you have. Because if you do nothing in 5 or 10 years, it's going to be even further back. Your edges are going to be even further
Right.
receding.
Right.
So, so it's always a good time to take care of something that needs to be addressed.
So, Dr. Lenzy, I want to highlight some of the things you just said, and then I know we're going to wrap up as we're coming on to some time. But one thing I really, really want to highlight to everybody is before you run YouTube or a friend to get an oil recommendation or, a product recommendation, the minute you see that your hairline or your edges are falling or receding, we have our way of saying things, but, when you notice that your edges are going, schedule an appointment. Go see a dermatologist. It may not be an issue, but it can be an issue. And as Dr. Lenzy suggested, it can be something that maybe the oil helped the first time, but then you
Mm-hmm.
go back, you continue the same bad habits that caused it, and then the second, third, or fourth time, the oil is not going to work. And maybe nothing is going to work because now it's permanent. And so
Right.
we don't want it to get to that point. So whenever you have excessive shedding, whenever you see that your edges aren't there, if your ponytails are thinner, you know your bodies, ladies. No one can tell you. When no one else can tell you. You're like, something is not right with my hair. 9
Mm-hmm.
times out of 10, it's not. That is a sign that you need to schedule an appointment. Because I'd rather schedule the appointment with the dermatologist and they say, oh, this is nothing. All you got to do is X, Y, D, and you'll be fine. Than me scheduling an appointment by the time my scalp is on fire, and they say, I'm sorry, Beverly, it's too late. There's nothing
Mm-hmm.
else that we can do. We exhausted all options. Or I don't know if that's the topic for conversation today, but what I do want to address is payment, and I do want to address people that says, well, I don't want to go to the dermatologist because I don't have money for that, or I don't want to pay for someone to just give me some oil to slap on my edges. What can you say to that person, to that woman who I think that there's a mental barrier that's blocking them from scheduling that doctor's appointment?
Sure. I think that's an excellent question. I find it interesting that we don't have an issue with paying to go on Amazon or to Sephora and buy whatever some layperson recommended for us, right? So we're spending money. Many of my patients have spent hundreds of dollars buying things that will not help them. And so you could have spent that same couple $100 if your insurance doesn't cover it, and many times it does, with seeing an expert and actually getting to the root, which is what I titled my book, Getting to the Root of the Problem. So I always tell people that are concerned about cost, we're spending money. We're spending money, whether it be on things that our friends tell us to do, a blogger told us to do on YouTube. We're spending money, but you don't know if the things that were recommended to you are for your case. And so for me, I always want to make sure if I'm spending my money, that it's going to be on something that's fruitful, that is actually going to help me, and not just trying. We love to try this, try that. When I prescribe something, I'm not telling you to try. I'm giving you a prescription treatment that I feel I'm 99.9% certain is going to work for you, because I've done the work to do the proper diagnosis, to do all of the proper things that need to go before just recommending something to you, versus you going on a blog and they haven't even looked at your scalp. They don't know. They're just telling you buy this oil, but they don't even know what you have. And so that's why I just say be careful about thinking about costs, because we're spending money anyway, and the money that we're spending might not be the best use of that money, and you can use it in a different way. But the good news is that a lot of insurances do cover a hair loss evaluation with the dermatologist. Some of the treatments might not be covered the same way Jamaican black castor oil is not covered. The same way these vitamins that you're buying that's not helping is not covered. So I always say, just be careful when the dermatologist recommends something for you and it's not covered, that you don't let that stop you, because we go get our hair done, that's not covered by our insurance. I always say that everything that we do is not covered by our insurance. So just because a doctor
Covered. Right.
don't let that stop you. It should actually be an encouragement that even though I'm going to have to spend money, this recommendation is coming from a scientific perspective, and there's actually research and data versus just a random recommendation.
Dr. Lenzy, that was awesome, and I love to reiterate what you say, because I like to break it down, and not that you don't make it, chewable, but I like to break it down for me, even especially. I like to reiterate. So it's true. Let's be honest. How many of us have flown to Miami or DR or Colombia, to get mommy makeover, and just fix something up, that nip and tuck. We don't mind paying to look good, to feel beautiful, to just kind of uplift our confidence. What's wrong with that? And so she's right. I think the thing that Dr. Lenzy said that stood out to me the most was, you would rather spend hundreds, if not, in my case, it was thousands of dollars, honestly, on products that may work, that might work. We don't know if this product is specifically for you, but, this commercial said that works, so I'm going to go ahead and try it, right? Versus going to a doctor who will evaluate your scalp, your specific situation, and then cater and create a customized treatment plan for you and what you're going through, and then recommend products that he knows is going to absolutely work for you. To me, it's a no-brainer. It's a no-brainer. And I honestly feel like it's a mindset shift. That's what we need to do. We do not mind paying hundreds, if not thousands of dollars for extensions, for wigs. And while that's beautiful, I'm not stopping nobody. This is not the conversation for that today. If you can spend that much money on cover-ups, why not investing in actually having thriving, beautiful hair? So the cover-up is an option and not mandatory, So I know there's so many more questions that people may have. I know I do, but we just can't uncover it all today. So I know I'm going to link Dr. Lenzy's book down below in the description box. Anywhere there's captions, I will link the book. And then also, if you want more information about the types of hair loss, but most importantly, the types of treatments, you can visit her website. Dr. Lenzy, can you call out your website for us, please?
Sure. It's my name, Lenzy Derm, LENZYDERM.com.
Thank you so much. I want to thank you so much for joining us today, the Hair Scrippers. Lady, she said something very powerful. She said not every doctor is necessarily who specializes in hair loss. So you want to find the right doctor. You can do that. Of course, you can visit Dr. Lenzy, or you can download the Hair Scripts app, and there you'll gain access to board-certified dermatologists of color who can help you with your hair loss. So thank you very much. Remember, you know your body. When it's time, go straight to the doctor. Your insurance may or may not cover the diagnostic or the evaluation, but it's an investment worth making, and you'll feel so much more confident at the end of the day. Thank you so much, Dr. Lenzy.
Thank you.
Thank you. Take care.
All right. Bye-bye.
Bye. Yeah, so